afternoon. My name is Dr. Trudy Fundu of Snowspirations, Global Health Solutions. Thank you so much and welcome to our Wednesday midweek community health clinic. I apologize for coming in a little bit late, but in the next few minutes, we are going to have meaningful discussion about today's topic. Now, today's topic is a topic of great importance to all women who are planning to become pregnant. We are going to talk about the fallopian tubes. Very, very important. So please, once you come in and you are ready for this clinic, please announce your name, announce your location, make sure you can see me and hear me clearly. Then as soon as possible, we're going to start. I'm planning to spend 30 minutes. So the first part of the presentation, I'm going to give you what I know regarding the fallopian tubes. Then afterwards, I'm going to collapse the clinic. Then you will have opportunity to get feedbacks from me. Okay, so please, when you come in, make sure you can see me, make sure you can hear me clearly. You can participate on different platforms. You can participate from group, from our page, from my private timeline, and from our YouTube. So long as you are in any of these platforms, you can participate. You can have an opportunity to ask your questions. We are going to look at the fallopian tubes. We are going to look at the function of the fallopian tubes. And we are going to look at the fallopian tube disorders, which can affect your ability to become pregnant. And I'm actually going to start. So fallopian tubes are very important structure, important part of the female reproductive system. Your fallopian tube is the bridge that connects the ovaries to the womb. So every woman is given two fallopian tubes. The role of your fallopian tube is to help the eggs that will be released to get into the tube, to wait for the sperm to come in and fertilize the egg. Now, the other function of the fallopian tube is to also allow the sperm to come from the side of the womb to enter a special place called the ampulla. Another function of the fallopian tube is to act as a holding ground, a conduit that will now transform the embryo. Embryo is the union of the egg and the sperm. So it's important to understand the function of the fallopian tubes. So anytime we have any problem with any of the functions, then it will not be possible for pregnancy to happen. So let's start from the side of the womb. So there are three different parts of the fallopian tubes I want you to pay attention to. The opening from the side of the womb is called the proximal part of the tube. Proximal part of the tube. Proximal means it's closer to the womb. The other part of the fallopian tube is the middle part. So that's the mid part of the fallopian tube. The part of the fallopian tube closer to the ovary is called the distal part of the fallopian tube. That's the part that will communicate with the ovaries, so that when the egg is released, that part will help to bring the egg inside the tube. So your fallopian tubes can have problems at the proximal end. If it has problem at the proximal end, the sperm cannot come in. If your fallopian tube has problem from the distal end, the eggs cannot come in. If your fallopian tubes have problems in the middle point, the sperm can come in, the eggs can come in, then after fertilization, it might not be able to transport that back to the womb. When that happens, you can have a condition we call ectopic pregnancy, which is deadly. So it's important that your fallopian tubes should, by default, function exactly the way it's designed. For a woman to become pregnant, you have to have at least one functional fallopian tube. Every woman is given two fallopian tubes. The reason why you have two fallopian tubes is to compensate. So in the event that one fallopian tube is damaged or diseased or cut off, you can still become pregnant so long as the other fallopian tube is what? Healthy. So for a woman to become pregnant and have her babies, including twins, including triplets, including quadruplets, you have to have at least one fallopian tube fully opened. When one of your fallopian tube is functional and the other needs damage, you can still become a mother. But when both fallopian tubes are damaged, maybe due to adhesions, maybe due to blockage, maybe cut off, then the only possibility for you to become pregnant is to think outside the box. And that's through IVF. There are a couple of things that can affect the health of your fallopian tubes. Number one, your fallopian tubes might not be fully developed from childbirth. If your fallopian tubes are not fully developed from childbirth, your ovaries might still have, you might still have sperm, but your fallopian tubes cannot perform their role. Now, some women can also damage their fallopian tubes if they have a condition we call pelvic inflammatory disease. Pelvic inflammatory disease is a condition that can come up when we have chronic sexually transmitted infections or poorly treated sexually transmitted infections. There are two bacterial organisms that can lead to this. Number one is chlamydia. The second one is gonorrhea. So when you have chlamydia or gonorrhea and they are not properly treated, they can graduate to pelvic inflammatory disease. Pelvic inflammatory disease can damage your tubes. When your tubes are damaged, they cannot perform their roles. In some women, they can develop what we call adhesions. When you have adhesions, they are bands of scar tissues which prevent your fallopian tubes from performing its role. Now, some women can have very big fibroid, which can impinge on your fallopian tubes. So when your fibroid is very big and it's impinging on the fallopian tubes, your fallopian tubes will not be able to perform its role. Now, if you've also had any surgery in your fallopian tubes, it can also affect the function of your fallopian tubes. Some women can have a swollen part of the fallopian tube, a condition we call hydrosalpinx. Unfortunately, when you have hydrosalpinx, the function of the tubes will be compromised and you will not be able to become pregnant. So any of the things I mentioned can affect your ability to become pregnant naturally. But the fact that your fallopian tubes is damaged doesn't mean you cannot become pregnant. You can still become pregnant, but you need to think outside the box. Now, how can we know you might have problems with your fallopian tubes? There is a special test we call HSG, hysterosalpingogram. Hysterosalpingogram is a special type of X-ray we can use to check if your tubes are open. If your tubes are open, when we pass the fluid through the vagina, through the cervix, inside the womb, it will pass through the womb and will go to the end of the tubes and will spill over, telling us that your tubes are open. Unfortunately, if your tubes are blocked, when we pass the fluid, they will not pass. So one of the best ways of diagnosing a problem in your tube is what? Through the process of HSG. This is a test that all women who are having infertility must go through. Now, what I'm here to help you do today is to face your reality. If you have been told that your tubes are damaged, when you go about spending the money you don't have, going from one place to the other to open the tube, you are wasting your money. Because when your tubes are damaged, they are damaged. Now, there are different grades of damaged tubes. You have mildly damaged fallopian tube, or moderately damaged fallopian tube, or completely or severely damaged fallopian tube. When your fallopian tube blockage is mild, when you go for your HSG, HSG is going to flush out that mild adhesion or mild blockage. Matter of fact, from research, women that go for HSG by default will have an improvement in their fertility because through the process of passing through that fluid, it can open a blocked tube. But unfortunately, if both tubes are blocked, when you go about flushing it, you are not helping yourself. it cannot work. In some places, if they have the expertise, there are some surgical procedures we can use to correct blocked fallopian tubes. But we have to make sure that they can handle it, because the problem is the fact that when you cause damage or when you're repairing the fallopian tubes, you can cause further damages. So when you have adhesions in the fallopian tubes, you take the patient to surgery. When that wound is healing, it can heal with further adhesions. This is the problem with having problems in the fallopian tubes. So unfortunately, most gynecologists will not attempt to go and do corrective surgery in the tube, because most times it will not help. It will rather harm. So instead of opening you up or going for surgery that will not help you, the best way to go about getting help if both tubes are blocked is to go for IVF. Very important. Now, in women that have hydrosalpinx, unfortunately, when you have hydrosalpinx, that part of the womb is damaged. That part of the tube is damaged. Now, if you are going for IVF and you were given a diagnosis of hydrosalpinx, it's advised we remove that part of the damaged tube, because when you succeed in becoming pregnant through IVF, if we keep the damaged fallopian tube, they can release some toxic chemicals, some toxic fluid, which can affect the developing embryo. So some women that have damaged tubes will be advised to go for removal through the process of salpingectomy. So we remove the two tubes. Thankfully, so long as you have functional ovaries and you are releasing your eggs, all you need to become a mother is your egg and the sperm. So some women can still become pregnant despite the fact that their tubes are damaged. So long as your womb is able to carry your baby, you can still become pregnant. But you need to face your reality. In our group, we do not encourage women to be going up and down flushing their tubes. When your tubes are damaged, they are damaged. You need to think about IVF. You need to go and raise money and start on time. So this, in a nutshell, it's what you need to know about your fallopian tubes. So in summary, your fallopian tubes can still give you good outcome if one part is damaged, but the other part is healthy. So if one fallopian tube is damaged, but the other one is healthy, you can still become pregnant. You can still have one baby. You can still have two babies. You can still have three babies. Unfortunately, if both tubes are damaged, you can only become pregnant through the process of IVF. Now, the only way for us to know the state of your tubes is to go for a special investigation we call HSG. So please, if in the past you had an infection, sexually transmitted infection, chlamydia or gonorrhea, both of them can be completely treated with problems. Now, the problem with intending to become pregnant, even with damaged tube, is the fact that you can still succeed in becoming pregnant. But when you become pregnant, that pregnancy will be ectopic pregnancy. Ectopic pregnancy is an emergency to kill the woman because the tubes are not structured and designed to support pregnancy. So any pregnancy developing in the tube can kill the woman, and unfortunately, the baby is not viable. So anytime we notice ectopic pregnancy, unfortunately, we have to that tube. Unfortunately. So this, in a nutshell, it's what you need to know about your tubes. Every woman that is going through fertility must go for their hysterosalpingogram. Now, this is what you need to do. If we tell you that your tubes are blocked the first time, go for a second opinion. Don't run with the first one. For some women, if they have mild blockage of the tube, if they go for HSG, when they go for a repeat HSG, their tubes will be open. So don't depend on just one test. Make sure you have at least 2 HSGs after they've told you your tubes are blocked. The second one can give us a better outlook. Very, very important. So all the women who are having tubal factor infertility, you have to face your reality. If one tube is open, you can use that one tube to become pregnant. If both tubes are open, the best prayer you can pray is for God to give you the money to go for IVF, because the earlier you go do this, the better. Okay, so I'm going to open the clinic now. I'm going to give you an opportunity to ask me questions, okay? So give me just 1 minute. Let me look for questions. So remember to follow the admin. Admin is going to help you with anything you need this afternoon. Okay, let's attend to your question. Let me look for questions, please. Hold on. Okay, here we go. Charts. Okay. And please, Dr. Ndichie will also be providing you feedbacks from background. But let's talk. So you can go ahead and you can start asking your questions now, please. Okay. Okay, so give me 1 minute. I'm looking for questions. The clinic is open. Feel free to ask all your questions, and I'll provide you feedbacks in the next few minutes. I'm currently searching for questions. Admin, you can also repost any question before I can see them. Okay. Okay, let's attend to this. What about someone with endometriosis? So endometriosis on its own, it's a gynecological condition that can affect your fertility. If you have endometriosis, for some reasons, the cells which only should be found in the cover of your womb are seen elsewhere. So if you have endometriosis, we can have endometrial cells in the tubes, we can have endometrial cells in the ovaries, we can have endometrial cells in where we call omentum. Endometriosis is a condition that can affect your fertility on its own. So imagine when you have endometriosis on top of a blocked tube. So if you have endometriosis, you need help under the care of a fertility specialist. There are a couple of women that might be lucky. We can use only drugs to correct your endometriosis. But some other women will also need surgery. So if you were told you have endometriosis, it's a very serious thing we need to attend to professionally. So you need to be under the care of a fertility specialist. Very, very, very important. Okay? Okay, guys, let's continue. Let's see what we have. Okay. Okay. Doc, aside what you mentioned, STD, what other factor can lead to tubal blockage? Like I mentioned, if you had any procedure done in the past. So if in the past we had any surgery in the tube, when that surgery is healing, it can lead to scar tissues, which will lead to adhesions. If you have very big fibroid, that fibroid can block your tubes by its own. So any of these factors can lead to tubal blockage. If in the past you had overwhelming infection, unfortunately in the body of an infection in the vagina can affect the cervix, can affect the womb, can affect the ovaries, can affect the tubes. So any infection which is not properly treated can by itself affect the function of your tubes. So the top on the list in factors that can lead to tubal blockage is what? Untreated or poorly treated sexually transmitted infection, of which chlamydia and gonorrhea are the two top contenders. If in the past you allowed yourself to go to a quack for abortion or for any procedure, they can also damage your reproductive system, including your tubes. Please keep asking your questions, okay? All right, guys. Okay, let's see. Okay. Okay, hold on. Doc, a woman at age 47 without menstruating, can she go for HSG test? All women, regardless of your age, should, by default, go for their hysterosalpingogram. It's a standard female fertility test. So once you are having female fertility issues and you subscribe and you come to me, There are a list of about 9 tests you have to do. Top on the list is HSG. We need to know the state of your tubes. Now, my sister, you are 47. Age is not on your side. Now, you need to be careful. The first thing we have to do for you at 47 is to confirm you still have eggs. So long as you haven't gone into menopause and you have eggs, by the time you're making love to your partner and you're praying, you should also consider IVF with donor eggs. So by standard, admin, capture this for me. All women who are considering IVF in their 40s are advised to use donor eggs. Why is it important to use donor eggs above 40? Because at 40, you have a reduction in quantity and quality of the eggs. Every woman is given the whole package of eggs they will use to start their family. Unfortunately, by the time you get to 35, the numbers are grossly reduced because every month you are losing both the dominant follicle and couple of other eggs. So if you are in your 40s, the possibility that your ovarian reserve is reduced is very high. So if you have to stock out money in millions and you are going for IVF and you are in your 40s, you are better served using donor. You will have a better outcome going for IVF above 40 when you use donor eggs. Please don't insist on having your way in a procedure that will fail. I know we are very prayerful. I know we are all Christian. I know that what God cannot do does not exist. But please, don't waste millions of naira insisting on using an egg that will fail on arrival. Consider using donor eggs if you are going for IVF and if you are in your 40s. So my sister, at 47, you should be worried for a genuine cause because you blink, it's possible you've gone into menopause. This is your reality. This is August. So if you're not seeing a fertility specialist, I will tell you to run to a fertility specialist because you do not have the liberty of wasting time. We need to know your current status. So can you still become pregnant naturally at 47? Yes, my sister. Better are the chances, limited chances. At 47, what's your best approach to becoming pregnant or to becoming a mother? IVF with donor eggs, surrogacy, and adoption. If you want to be a mother in 2022 and you are in your 40s, there are 3 things you must do. You must present yourself holy, diligent, by way of practicing, praying, playing, and practicing. When you have done that, you present yourself to a fertility specialist. You start to consider IVF with donor eggs. When you are considering IVF with donor eggs, you should also start looking for a baby to adopt. When you are looking for a baby to adopt, you should also open up yourself for surrogacy. Unfortunately, as you are getting older, your chances of having pregnancy achieved is dwindling. And even in some women, when they end up becoming pregnant, they will have a lot of complications. But every woman can become a mother if they activate other options of becoming a mother. You can not only become a mother through the natural means. If the natural means of becoming a mother fails, you activate your assisted reproductive technique. That reminds me, our PDF on assisted reproductive technique. So the topics we covered IVF, we covered IUI, we covered surrogacy, we covered adoption, we covered fertility treatment. If you were not able to attend our symposium, the IVF, the IUI, the surrogacy, and the donor egg, donor sperm adoption PDF is out. So admin, share it with anybody interested. All you need to do is to click on the PDF. You're gonna see the PDF. You're gonna have an opportunity to watch about 3 hours intensive teaching on assisted reproductive technique. Okay, so let's continue. Okay, someone is asking, How can one treat tubal adhesions? By adhesions. How can one treat tubal blockage? By pelvic adhesions. Now, my sister, listen to me. I'm going to be very, very frank and open to you. If you have adhesions in the cervix or in the womb and it's mild, we can do what we call adheolysis. We can split those adhesions and we can see if we can help you to become pregnant. Unfortunately, if your tubes have pelvic adhesions, the problem is if we go to your tubes, if we go to your tubes to correct it with surgery, we can cause further damage. So imagine trying to save someone that is sinking and we are digging more hole. What's going to happen? The person will continue to sink. So the process of correcting the tube, by the time we are trying to correct the tube, we can cause further damage. So my sister, what you need is a reality check, an action-oriented plan. If your tubes, admin, just take this for me and share it with our members. If your two tubes are confirmed blocked, stop praying the wrong kind of prayer. The best prayer you can pray is for God to give you enough money and for God to provide a caring, conscientious, evidence-based, intelligent fertility specialist that will conduct IVF. IVF is your best option if your tubes are damaged, both of them. If one is damaged, you can still become pregnant. But my sister, listen to me carefully. You do not want to turn up at age 60 and 20 years ago, they told you your tubes are blocked, but you're still believing God. Meanwhile, God has told you you need to go and do IVF. So when you say your prayer and when you begin to bind and cast IVF and donor eggs and donor sperm and adoption and surrogacy, you are actually preventing yourself from becoming pregnant. If God says you're going to become pregnant through IVF, you can only become pregnant through IVF. If God says you're going to be a mother through adoption, you can only become a mother through adoption. If God says you're going to become a mother through fertility treatment, you can only become a mother through fertility treatment. So God's ways are not our ways. So stop leaning on your own understanding. The body of a woman is very delicate. But every woman has the right to be a mother. It's your right. It's your blessed assurance. But if you don't take the necessary actions, you might end your life alone. And guess what will happen when you're alone? You're not going to be happy. You're going to likely be depressed. Some women might be suicidal. Some women will die unhappy. Guess what? Don't die trying to please the world and displeasing yourself. So if you have the money today, listen to me carefully. If God gave you resources, my sister, this is August though. This is not January. Some of you are going to go into menopause by December. If you are not able to go for IVF, are you able to go for donor eggs? No. Why? Because we believe we know everything. So while you still have eggs, this is your money. Where I'm from, they said, if you are looking for a black goat, start looking for the black goat in the morning. Because when it's dark, you cannot differentiate the black goat and darkness. Let me repeat again. If you're not Igbo, I'm going to interpret for you. If you are looking for a missing black goat, Biko, start looking for that missing black goat in the morning, up to afternoon and evening. Because if it's night, you cannot differentiate the black goat from night. Why am I saying this? Please, and please, if God kept you alive on this day, the 4th day of August, and you still want to be a mother, and you still want to be a father, when you have felt bad, when you have complained, ask yourself, look yourself up the mirror. Have you done enough? Have you used enough money? Do you have a fertility specialist? Are you making love? Are you praying? Are you exercising? Are you eating good food? Are you sleeping? Are you watching your body weight? These are the things that will help you to become pregnant and become a mother and a father in 2022. Now, if you're not doing this, then you're not getting it right. So many of you have money, but you're spending your money in the wrong place. You cannot be wanting to be a mother and a father, and you're throwing out one day party, and you're using your money to go and buy cars, buy shoes, buy ashwebi, but you cannot afford 2,000 naira to come for consult. Do you understand that 2,000 naira can end your infertility in this group? So you need to prioritize. Admin, capture this for me. Prioritize your infertility. Don't be complacent. Don't be comfortable in your infertility. Unfortunately, some women have resigned their faith to God. Oh, what can I do now? What can I do? And you will be in what can you do and what can you do? And you go into menopause. But you know your mother. Your mother will discourage you. Your grandmother will discourage you. Your pastor will discourage you. Everybody that doesn't know anything about your happiness is discouraging you. But you know that becoming a mother will make you happy. At the end of the day, you please the whole world, then you die in misery. No member of our group should die without having a baby. The women in our group must have their boys, must have girls, must have their twins. Unfortunately, when you are older, you have an opportunity of having twins. You have an opportunity of having triplets, but you need to exercise your faith. So if you have to do IVF, even if you're living in Eskimo, if you want to go back to Nigeria, we can set you up. Decide to end infertility, dump your infertility. Admin, capture this for me. Dump your infertility in 2021. Do not advance to 2022 with infertility. We do not have any provisions for anybody carrying over infertility from 2021 to 2022. Our 2022 is Celebration 2022. We are gonna launch our brand new mothers, brand new fathers, brand new babies, twins, triplets, quadruplets in this group. So refuse to carry your 2021 baggage into 2022. It takes 9 months to conceive and have a baby. So I'm challenging you today. If you're hearing my voice, do something. Call a family meeting. Complain for the genuine reason. If your relationship is toxic, walk away. If you're single, this one will surprise a lot of you. If you're single and you know you want to be a mother, you better start having meaningful conversation with your gynecologist. If you are a lady and you're waiting for that tall, dark, handsome man to fall from heaven, you are deceiving yourself. Make yourself approachable. Make yourself marriable. Start a relationship. Start friendship. Go to the next stage. You will see some women 48. They are still waiting for this and waiting for that. Then before you blink, it's all over. Now, if this stance is a problem in your relationship, there is also something about it. We can freeze your eggs, we can freeze your sperm, and you can still become that. So there is absolutely no reason why you can't become a mother and a father in 2022. Thank you for coming. Remember, tomorrow, join Dr. Ndichie. Join me on Friday. If you need help, follow admin. There are categories of things you can do to get help. The least you can use to get help is 2,000 naira for 1 week. If 2,000 naira is all you can afford to crumble infertility, why not? Why will you have the resources to defeat infertility and you're not using it? Unfortunately, it's expensive. If you can afford 1 month, use 1 month to solve your problem. If you can afford 3 months, why not? If it's 6 months, why not? If you are already pregnant, then be careful. Some women will go through the valleys and shadows of infertility. When they succeed in becoming pregnant, they will begin to be smart. Please ensure your pregnancy by going to ANC. Don't come to my inbox. Fortunately, women will come to my inbox when it's already late. When you are bleeding, see your baby in your womb, that's too late. When you become pregnant, when you check your urine, when you check your blood, when you check ultrasound, and it's confirmed you're pregnant, register for ANC on time. It is important. You cannot afford to be smart because sometimes you can outsmart yourself. Plan for your pregnancy. Plan for your infertility. Put them on top of the list. Rearrange your priority. Some people, their top priority is to go and build a house in the village, to buy big cars, to impress people that are gossiping about you. Who are you impressing? Which one are you going for? Which are you going for? When your friends are mocking you that you're not a father, you're not a mother, and every day you're on sleep. So why don't you use your resources to do the right thing? If you're in Lagos, use the best. If you're in Port Harcourt, use the best, and we can help you. Stop wasting time. Be genuine. Be truthful. When you see babies out there, when you see testimonies, there is something that mother did. Some of them went for IVF. Some of them had 6. We had a lady in this group, 6 failed IVF. She persisted and she became a mother of 3. She had triplets. She went for surrogacy. 6. So are you kidding me? Our God is a good God. So thank you for coming. But please, activate your faith. Activate your praying. Activate your playing. And activate your practice. Change your mind and you will become a father. Change your mind and you become a mother. Later tonight by 7 p.m., if you are still up, join me in my YouTube live presentation. You do not want to miss today's presentation. A 20-year-old lady who had first contact with the boyfriend and they involved themselves in foreplay, and there was no penetrative sex. Lo and behold, she missed a period for 3 months. And when she went for pregnancy test, she was pregnant. Now, the question is, can a virgin be pregnant? Are there other avenues a woman can get pregnant without having sex? You don't want to miss this open, live YouTube discussion. Admin is going to share our link. If you haven't subscribed to my YouTube channel, make sure you subscribe and join me by 7 p.m. I love you guys. I'll see you guys tomorrow. Until I see you, God bless you and bye-bye.